Yeah, no, no. Of course they're going to deny it. I did the same to my doctor. My doctor knows they hurt me. They know they hurt me. They're educated. They're an endocrinologist. Of course they know they hurt me. But they're not going to admit that because then they can get sued, right? So, yeah, I mean, you're never going to get the doctor to say, oh, yeah, the medicine I prescribed you hurt you. Never. Hey, everyone. I do not have much time, so I have to make this quick. This is a detransitioner, a detransitioned woman who goes by the name of Carol. And this is her channel, and I will have this linked in the description below. And you can go to her channel, check out her videos. I'm not going to go through this whole video. I'm just going to go through pieces of it. Yeah, I need to make this quick. I just want to address this one comment. Are on the informed consent paper. No, they're not. A lot of them aren't. So that's just not correct. Some of the things she talks about are not on there. Type 2 diabetes, where's that on the informed consent? Panic attacks, I don't think that one's on there. There's also a lot of things in the medical literature that we've gone over on my channel and that we will go over in the future in terms of the literature. I do that every month. I read the literature and I bring you the most interesting things. And you're going to see things every single month that were not on the informed consent things, I guarantee you. So just something to keep in mind. That said, let's get into a video, and I'm just going to show you pieces, and then you can check out the rest if you want.
Testosterone could cause vaginal dryness. Could cause. There's no could about it. You will get that. You will have issues with your vagina if you go on testosterone and you're a female. So, yes, the vaginal atrophy. By the way, atrophy is not some dryness. Atrophy is thinning of the walls of the vagina.
That is horrifying, and I don't even have one of those.
Cracking, extreme dryness, and you also can bleed from the cracking, and it's very, very painful. Also, with those issues, it opens you up to having other issues like, you know, chronic yeast infections and just other, you know, infections and irritation and just, you know, all kinds of stuff. So I was totally not prepared for that. The other thing is, I was not prepared for the fact that testosterone would affect my cholesterol levels and my blood glucose.
Yeah, and that's a really common thing too. I mean, we've talked about that many times on this channel. Blood glucose, triglycerides, total cholesterol, blood pressure, kidney disease due to blood pressure issues, heart disease due to cholesterol and blood pressure issues, and triglycerides, atherosclerosis due to all these issues as well. This is well known, and it's going to happen to almost every single person who takes testosterone in a way that their body is not supposed to, both men and women. If they go above where their body is supposed to be, it's going to happen pretty reliably. And so this is a common thing, and it should absolutely be on those papers. They should tell you, type 2 diabetes risk over your lifetime is going to go up fairly dramatically, and you're going to have worse lipid levels, which can cause things like heart disease, which can cause things like Alzheimer's, which can cause things like, you know, chronic kidney disease in terms of the blood pressure, atherosclerosis, all of this stuff.
So fast. I was told that it's me going on testosterone was just going to make me have the same kind of issues that a cis guy would have, so a man would have.
And this is why I really wanted to highlight her channel, because she's one of the first people I've heard talk. I'm sure there are many more who've talked about this. One of the first I've heard talk about this. This is what they tell you. I forgot about this. They tell you that it'll impact you, like they told me. Yeah, it'll impact you just like it impacts any woman taking this estrogen. That's not true. And they're telling women, oh, it'll impact you like it's impacted any man taking testosterone. Untrue. You're going to be a woman on too high testosterone. It's going to impact you in that way. Completely different from a man being on it, who is supposed to be on it. His body's going to function properly. Axel Anzik has talked about things like the pancreas, how those are very sexually dimorphic. But every organ really is. I mean, the heart is. So when you're taking testosterone, your heart's going to increase in size. We've talked about this. That's not good. And women are going to have more issues with that because their hearts aren't supposed to be doing that, because they're not supposed to have that much testosterone. And that can cause all sorts of blood pressure issues and just circulatory issues in general. Also, the hematocrit, which I'm sure they do tell you about the hematocrit. They probably do. But I don't think people understand what is actually happening. Because they tell you, oh yeah, you can get polycythemia, or you can get high hematocrit. That can be an issue. They don't tell you why, though. That can be an issue because you can literally just drop dead from it from a blood clot, just suddenly. Literally instant death. So, like, and as they did, and we saw the study, most people, well, not most, I should say, I think the study said 25% of trans-identified men had polycythemia, but that was in a short-term study. So affected over a long period of time, I would say probably most people are going to at some point have this condition, which means at some point they're going to be at an increased risk of instant death. And I don't think they're told about that.
And doctors repeat this over and over again. This isn't Planned Parenthood. This is repeated just multiple times wherever you go.
Yeah, it is.
And that's not true. But I was having some other issues that like needed to be addressed. So that was what was happening with my last blood work. Then I went after stopping testosterone, 3 months after stopping testosterone, I went for another full panel. My endocrinologist wanted to see where I was 3 months after stopping. I went, and would you believe that all my blood work had dropped down to normal, healthy levels? Like it was, well, close to like it was before starting testosterone 4 years ago. 3 months. What that tells me is that was testosterone doing that. That was the drug. The drug was causing me to be very unhealthy.
Yeah, and it reliably will do this as people age and take this drug. 3 months is pretty incredible. To return to, from pre-diabetic to no longer pre-diabetic. So that's really good. Diabetes causes all sorts of issues. It's one of our #1 killers in the USA and the world in general at this point. So fixing that issue by simply stopping this damaging medication, in this case testosterone for a woman, is life-changing.
Because the other thing too is I was actually more healthy, like far as exercise and eating and just those kind of things when I was on testosterone than before. Like I was more active and stuff on testosterone, so it really wasn't any kind of change outside of the drug. Mm-hmm. So I was not. They did not tell me that. Hey, guess what? You're gonna have a lot of fucking issues.
No shit, they didn't tell you. Imagine they did. I mean, imagine the doctor goes, hey, look, you can transition, but you're gonna have a fuck ton of issues. They would get fired. They'd get canceled, right? And they'd also probably lose their license because that's not how you prescribe medication. Because if you were prescribing medication that made people have a shit ton of issues, you'd probably be doing malpractice, which is sort of what they're doing. It just happens to be the standard of care. So, yeah. I mean, they should tell you that. But imagine if they did. I mean, imagine if they were actually honest and told you everything that they know happens, that they have evidence happens. Nobody in their right mind would take it. And, well, of course.
I also was not super prepared for the hair loss. I mean, they say the thing is, they say all these side effects are possible. Mm-hmm. They don't tell you that it is going to happen. And the fact is it is going to happen. Mm-hmm. All of the possible side effects they tell you, pretty much most of them will happen to you.
Including, the triglycerides, total cholesterol, everything will happen to every single person who goes on it. It's almost exclusively. I mean, almost everyone will have every single issue. She's right. just to varying degrees, depending on your genetics, lifestyle, all sorts of different things. Some people will have less atrophy and dryness. Some people will have better lipid levels. Some people will have, it will vary for everyone, depending on genetics and lifestyle and, diet, all sorts of different things. And so, yeah, but she's right. I mean, you're going to probably experience, especially over a long period of time, every single issue that they warn you about.
If you're not.
And so the point of that is that they should tell you, hey, you're going to experience these things probably at some point, and they may need to be addressed in the case of cholesterol, lipids, triglycerides, insulin resistance, this sort of thing.
On testosterone for long enough, and it depends. One of the things that can happen that I wasn't told about, this didn't happen to me, but I had a friend who was on testosterone for only 2 years, and this happened to her, is going on testosterone can also cause you to have some incontinence, which is
I highly doubt that is on the informed consent paper. I would be very, very surprised if that was on the informed consent paper.
Basically, you pee a little bit, and you can't hold it, and either you leak urine or you just sometimes you have more accidents, and so. I'm just going to hypothesize this could be due to a whole host of issues. Obviously, the vaginal atrophy could cause this, but we're dealing with urethra and the bladder here in this case, so not really the vagina, and so. What I'm thinking is it could be a sign of chronic kidney disease, which is very common in these sort of patients, trans-identified women on testosterone. Very common chronic kidney disease. Kidneys, of course, control excretion of certain things and could cause incontinence, or it could be due to atrophy of the urethra or some sort of bladder issue, infection due to atrophy. I don't know. I'm hypothesizing, but so many systems are affected down there. No shit. So yeah, it's going to have some issues, and in this case, incontinence, which is, it's sort of a demoralizing thing to have. No one wants to have this, and it actually really impacts your life because suddenly you'll just pee, and that like is socially not really acceptable, obviously, and it can really mess with your social life and your life in general, and your confidence going outside. You may feel like you can't go out because you're too afraid you're going to pee yourself everywhere, So this one issue can totally ruin your life. So, I was not told about that, and that didn't happen to me. However, like I said, I had a friend who was having she was having leakage, and she was only 2 years on testosterone, and she was a young woman. And when she stopped testosterone, it within a couple months it stopped. So again, it was the testosterone doing that. And
I gotta say, I am surprised at their recovery times, a couple months. It makes sense, but I'm just surprised that it took that it was that quick.
So, yeah, there is so many things I was not really told about, and even when I would directly ask my doctors, multiple doctors, is this being caused by testosterone? They would deny it. No. Another thing.
Yeah, no. Of course they're going to deny it. I did the same to my doctor. My doctor knows they hurt me. They know they hurt me. They're educated. They're an endocrinologist. Of course they know they hurt me. But they're not going to admit that because then they can get sued, right? So, yeah, I mean, you're never going to get the doctor to say, oh, yeah, the medicine I prescribed you hurt you. Never.
The thing I wasn't prepared for is that testosterone would impact my anxiety a lot. At first, it helped it and helped my depression, but then after about a year or so, the drug messed up my mental health big time. Like, I had just major panic disorder. It made my panic really, really, really bad. And I mean, I kind of joke about this, but I kind of think it too. I think testosterone broke a little bit of my brain.
So testosterone is known to increase psychotic symptoms. In this case, could be increasing paranoia, and especially because she's dealing with so many health issues, paranoia about health. And so she's dealing with real health issues, and her anxiety is probably increased. It probably helped with the depression because it increases your mood, but it upregulates it, meaning it can increase anxiety because you're sort of activated on testosterone. And so you're more, in this case, paranoid, can cause psychotic symptoms. So you're paranoid about your health, which is actually deteriorating, but you're also paranoid about it. And then, of course, you might think, oh my God, am I having a heart attack? You might actually be experiencing heart issues because of the type 2 diabetes, the pre-diabetes, the triglyceride issues. You might actually be, your heart might be going, oh man, I'm not doing so well. And then you're thinking, and then you feel that and you're like, oh God. And then because you're so activated from the testosterone, you're like, and you actually have a panic attack because of a real symptom. And of course, testosterone is very well known to also increase the adrenaline response, the fight or flight response. So yeah, totally believe this. And I could absolutely see how it would happen.
I did not have a panic disorder before, and I developed one on testosterone, and I do have a panic disorder now, and I take medication for it. So it sucks. There is a multitude of things that going on testosterone, which is an anabolic steroid, will do to you if you're a female. Well, males also, but I'm talking about females here. The best advice I would give, if you want to learn about the actual real side effects and real impact of going on testosterone, anabolic steroid, if you are female, is to look up studies done on female bodybuilders who used anabolic.
Yeah, that's a great idea. Look up studies on female bodybuilders who used steroids, like she said. Great way to do it because you'll actually see the real complications. There's a lot more data on them than there are on trans people. Although increasingly there are also really good studies on trans people showing these exact same things happening. But it's a great piece of advice from her. With that, I have to go because I have things to do. But yeah, please check out our channel. Again, linked in the description. Take care.